Well, in the interest of time, let's go ahead and get started. I'm Annika Donor with the Committee to Protect Medicare. Thank you all for joining. If you do need to record this, please give me a chat and I will make sure that you can do that. But I'm going to turn it over to Dr. Bernard Ashby.
Hello, everyone. My name is Dr. Bernard Ashby. I am a vascular cardiologist and health policy expert, and I am a proud son of Florida, and I was born and raised in South Florida, and I currently reside in Miami, Florida. So let's go ahead and get into it. I'm here today with my colleagues, Dr. Monet Mangat and Dr. Leonardo Alonso. As physicians and parents, we're here to urge Governor Ron DeSantis and President Trump to put in place robust safety measures to protect students, teachers, and faculty before suggesting the idea of reopening brick and mortar schools. COVID-19 continues to ravage Florida. More than 6,000 people in Florida have died. More than 440,000 people have been infected. Yet some of our political leaders are pushing schools to reopen in-person learning. President Trump tweeted in all caps, "Schools must reopen," with not one, not two, but 3 exclamation points just to get his point across. Education Secretary Betty DeVos has threatened to cut school funding if schools fully reopen. And Florida Governor Ron DeSantis issued an order on July 6th requiring Florida schools to be physically open for in-person classes 5 days a week by the end of August. It's true that in-person face-to-face learning is well documented, the benefits of which are well documented on students' academic, emotional, and physical well-being. For many students, schools are places where they can learn in safe environments, where they develop social and problem-solving skills, and even where they get their main meals of the day. We must acknowledge the advantages of having students being physically present in schools. At the same time, as a physician and a cardiologist who spends every day on the front lines fighting the COVID-19 pandemic, I join my colleagues in medicine who urge our policymakers to think through all the ramifications of reopening schools to our children, to our staff, and to our families and our communities. Florida has 5 of the nation's largest 10 public school districts, serving a total of 12 million students. About 14% of the individuals are under the age of 18 have tested positive in Florida, nearly 3 times higher than the recommended overall positivity rate of 5%, according to Johns Hopkins University. And we're seeing this surge before kids are even back in school, in classes for 8 hours a day. Young people are significant spreaders of COVID-19, and this disease must not be taken lightly. We're learning from the medical evidence that patients who are infected with COVID-19 can suffer lingering, even long-lasting adverse health effects. We are seeing patients with secondary heart and lung damage from COVID-19. Even patients who are not sick enough to be even hospitalized are coming in with these effects. The decision to reopen schools must take into consideration these life-altering risks. The decision to reopen schools, whether in person or remote learning, must also take the safety and wellness of the whole student seriously. The decision to reopen schools and when to reopen must not be made lightly and should not be made for political expediency. Rather than dictating a blanket order to reopen all schools, regardless of school community needs and safety threats, our leaders have to have the responsibility to ensure every child has the opportunity to learn safely, not just those from privileged backgrounds. We still have a narrow window of time to act. As a physician, we urge our leaders to act now to protect our children and teachers during the COVID-19 pandemic. I'd now like to invite Dr. Mona Mangat to say a few words.
Oh, Dr. Mangat, you're muted.
Sorry. Okay, thanks, Dr. Ashby, for the words. And my name is Dr. Mona Mangat. Last name is Mangat. I practice allergy immunology in St. Petersburg, Florida. And practicing allergy immunology means that I'm caring for some of the sickest asthmatics and immunodeficient patients in my community. So as a mother, I'm joining parents across Florida and across the country to urge Governor DeSantis and President Trump to use every resource they have to keep children as safe as possible from COVID-19. And as a physician who's caring for these sick patients and on the front line of this pandemic, I want to make it clear that we can improve safety if we take specific steps. But these steps have to be informed by science, data, best practices from public health, medical, and education experts. And these safety measures include providing schools with the ability to do rapid result testing of students and school staff frequently, extensively, and regularly. This requires additional funding. And we have to work with public health agencies because schools have to have the ability to do robust contact tracing to quickly and effectively identify exposures and isolate outbreaks. We know there are going to be cases of COVID once school begins in the school system. And currently the state of Florida has less than half the number of contact tracers that are needed. So this is also going to require additional funding and attention. All staff and students above certain grades should have enough masks and other protective equipment to minimize exposure. This is going to require additional funding. And schools have to have the resources to do frequent cleaning and sanitization of the classrooms and high-touch surface areas, including hand washing for everyone in the schools and enough cleaning staff. That's going to take resources. I'm having conversations every single day with parents and families who are having to make these tough decisions about whether to send their kids back to a brick and mortar school or whether to do online or a hybrid model. And every family has to make tough decisions based on their own personal circumstances. What I think parents need to know is that the governor is making these decisions based in science and that their policy is not being driven by politics. During this difficult time, there's high levels of anxiety and stress that don't discriminate between young or old or rich or poor. We have to be able to provide the emotional and behavioral support services and resources that students and staff are going to need, which can further remove barriers to learning, whether we do it in person or remotely. We have to also support low-income students with remote learning when necessary. That means including providing the technology they need, access to broadband internet, and nutritious meals so that they don't go hungry. And we have to support their parents who have to stay home, but they can't always take time off if their children are sick. No two school districts are the same. And so local school districts should decide when and how to reopen their schools using data and science-backed benchmarks on community infection rates. Doctors and public health officials should be helping guide these very important decisions. Science and evidence warns us that putting hundreds and thousands of young people, teachers, and staff together in enclosed spaces like school buildings is an invitation for a COVID-19 super spreader event. We know we can take precautions now to keep that from happening and instead make learning safer for our children, whether they're physically in their schools or learning virtually. So I thank you for the opportunity to speak, and I'd like to invite Dr. Leonardo Alonso to say a few words.
Hello. Is it my turn?
Yeah.
All right. Hi, I'm Dr. Leo Alonso. I live in Jacksonville, Florida, and I've been practicing emergency medicine here for almost 30 years. And I'm glad that the RNC decided not to have their convention here, since we're one of the hot spots, and it was becoming, I think, a political issue, not like Dr. Mangat said, based on good science. Jacksonville has a large public school system. We have over 130 students, almost 200 schools, which averages to about 650 students per building. And as you know, the CDC has made recommendations against mass gatherings. And it's not that having the kids return to school is an absolute no. It has to be done based on science and with the colleague, Dr. Mangat's guidelines or CDC guidelines. They have to make sense. And we're concerned that the governor is not prioritizing the funding as well as the president, which they're actually putting strings attached to forcing some schools to return before they get federal funding. As you know, the health experts say that the disease can be spread by droplets. That's why mask wearing is encouraged. And that's why these conditions that were just laid out are so important. And parents shouldn't really be forced into black or white. I've got to get the kids back to school and send them to potential virus spreading environments. And I see in the ER all the time, I see parents bringing their kids, and it's amazing how many are testing positive that are totally asymptomatic. Yes, children do have milder symptoms, and actually many have no symptoms, but yet they can spread the disease. So the elderly, when they come home to their grandparents or to their older parents that may have comorbidities, these are issues. So, you know, over 600,000 Floridians have lost their insurance, and that's another thing. You know, if you spread the virus, you dispose or you predispose parents and adults that have no access to healthcare now because they lost their jobs. This is tragic at many levels, and I think that has to be recognized. So I think we need to do everything in our power to base our decisions on good data, good science, and I commend my colleagues in sharing that. That's it. Any questions?
If you'd like to use the raise your hand feature, you can do that to ask questions. You can also type them into the chat box if you prefer. Yes.
Hello, can you guys hear me?
Yes, go ahead. Thank you.
Okay, hi, my name is Elizabeth Pace. I'm with Action News Jax in Jacksonville as well. My question is, we've seen cases go up for pediatric cases, including hospitalizations. At what point do they need to decrease that it would be safe to put kids back into school?
I think that's a fantastic question, and it's one that unfortunately has not been clearly delineated yet. Many of these decisions, many of the recommendations from the AAP and the CDC in general mandate or recommend that schools not open when there are high community transmission rates. Now, several bodies have tried to comment on what high community transmission rates look like. We definitely know that we're nowhere near those rates. That would be somewhere near what we would consider a positivity case rate of 5%. Currently, the state is more like 12% or higher. Now, each individual community obviously has their own specific rates. Where I am right now in St. Petersburg, our 14-day average rate has dropped to about 9%. So in general, there are some benchmarks in terms of seeing 14 days of decreased number of cases, 14-day percentage positivity rate declining, and hopefully being around 5%. The key is that right now, even if things have plateaued and you're here, you would like your plateau to be here when you put hundreds of thousands of students back together, because you know you're going to see cases in that scenario. So I hope that answers your question.
Yes, thank you.
Mm-hmm.
We also had a question from Ari in the chat box who asked, how do you rate Florida's plans for reopening?
Do you want me to give it a grade? I mean, so the question is do they have a plan, and is it adequate? Because we have a couple of statements from our president and our governor, but the plans are actually pretty murky, and that's part of the problem. We don't have a clear, specific policy to make sure that we prevent transmission of the virus, but also prevent a super spreader event from occurring. So if a virus were to occur, or at least if a sick person were to come to school and be inside of the building, how do we prevent that from spreading, and how do we learn that early, and are we able to contact trace? And we don't have a clear plan for that, and that's part of our policy recommendations for the governor to follow.
I think another important point is that that local communities are working really, really hard to come up with good plans and safe plans to try to bring students back to school. But the problem is they're working under the confines of a mandate by the governor, which says that you must have 5 days a week in-person brick and mortar education being offered in August. And so that really ties the hands of superintendents and school boards across the state. And it's forcing them to make plans that are not in line with most national guidelines for reopening. So I think that on a local level, people are doing really good work and trying to really follow guidelines, but we're being hamstrung by the national and state leadership.
Okay, we have a question from Hatzel Vela.
Yeah, can you hear me?
Yes,
Yes.
we can, thank you.
Perfect. Dr. Alonso talked briefly about it, and we've heard the governor mention this several times where he says kids are low risk, but when talking to local health experts like Dr. Eileen Marty, she repeated what Dr. Alonso just said. Can all doctors please share with us what the research shows in terms of kids spreading it and the dangers that come with that when we're in the middle of a pandemic?
I'm happy to comment first, and then Dr. Alonso, let you comment. I will just say that a lot of the data that we have seen so far, it has to be taken in the context that we have not had school open for the vast majority of time that this pandemic has been occurring. So we've not had a lot of data where schools are open in the United States to identify how exactly this is going to be spread in a school environment. From the limited data we have right now, it does show that children usually have milder disease and seem to be less likely to spread to adults. But I would take that information with a lot of caution, because we have not had a scenario where we have petri dishes open all across our country, which is what school is basically. And I'll let Dr. Alonso comment.
Yes, I want to echo that most of the data comes from other countries that had, first of all, much stricter guidelines of restriction, of testing, of tracing, and they tended to have lower rates than we did. So yes, the data seems to show, based on those countries and those studies, and I can't quote you exact numbers, but that the transmission rate is lower with children. It's certainly not zero. And they seem, because they have milder symptoms, they seem asymptomatic, which I think lowers the guard in the parents. And like I just said, these children do go to homes. They often interact with grandparents or older parents or people with comorbidities. So it's a false sense of security that just because they themselves get sick less often, they are not capable of transmitting the disease. The data certainly shows that. I'm seeing it on a personal basis at work all the time. So I think we still need good, common sense, science-based safety standards imposed before we open up. I hope that answered your question.
It did, thank you.
Okay, we've got a question from Emily in the chat box, which is there one school district that you think is doing things right that other districts should look to?
I think there's quite a bit of variety among the school districts. I've been looking at some of the ones across the state, and some people are coming up with really innovative ideas. I think any school district that is working to minimize the amount of students that will be in a brick and mortar setting are doing the right thing. And so schools that are offering hybrid options, or obviously some school districts are doing all virtual, which is taking the path of greatest caution, but there are innovative ideas. People are trying to do classes outdoors, and changing how lunch is done, and so lots of exciting ideas. But really, we have to be thinking about this in terms of what is happening in the rest of the community. The school is not just an isolated place. I mean, it functions within the context of a community, so it's important to remember that.
We had another question from Forrest. how do you think schools should handle an outbreak if it comes to that?
So everything should be done to prevent an outbreak, but recognizing that when you're putting thousands of students together in a school, you're going to have an outbreak. All of the things that we talked about have to be in place, and there has to be money for all of those things. So when you identify a case, you have to be able to rapidly test and get results within 24 hours. You have to have the funding to contact trace every person that that patient has been in contact with. You have to have a plan in place for how that student or teacher or everyone who has to be quarantined is going to continue their education. And you have to make sure that you have the capacity in your community to handle that sort of event, which you know is coming. So currently, I don't think that any of our schools they have great plans in place, but you know, they have to come to reality, they have to come to fruition, and that's going to take money.
But I just want to echo one point regarding rapid testing. That is really the bedrock of mitigating an outbreak. We need rapid testing. So currently, in the state of Florida, the average wait time is 5 to 7 days, which is ridiculous. So there are machines that are available that can get you results in as little as 30 minutes. Those that testing capacity needs to be available to all schools that decide to reopen at a minimum.
Yes, I work in an emergency department that has that test, 30 minutes, and as you've read in the national news, it's appalling that people are getting tested in centers throughout the country and getting the results a week later. That does no good. They're positive for a week, spreading. And I personally have several family members down in Miami that were positive, and it spread and people died. So yeah, our testing to some degree is a little bit of a joke when you're getting turnaround times of results of 5 days plus. That's unacceptable.
Mm-hmm.
And we're currently using this technology, as it was alluded to, in the hospitals currently. So we're not just using it in the ER, but we're using it in the hospital for outpatient procedures such as knee replacements and elective surgeries in that kind of category. But any patient that comes in, we're using that technology to our benefit, and there's no reason that it shouldn't be available to the public.
Mm-hmm.
All right, we've got what looks like a final question from Emily. What sort of protections should faculty members be asking from their employers?
I imagine that means, if I can clarify the question, does that mean like, should teachers and those that work in the schools be asking their employers for certain items? Is that what the question is?
Yes.
Okay, yeah. You know, the ideal situation is that a teacher is going to have exposure to a limited number of students in a classroom, such that you can have social distancing at least between 3 and 6 feet apart between students and teachers. I have spoken with a lot of teachers who are talking about creating or asking for plexiglass shields between their desk and the space where they'll be speaking to their students. At a minimum, every teacher needs to have a mask and either goggles or some sort of shield over their eyes, access to hand sanitizer in their rooms, and good ventilation in their rooms. I think at a minimum, that's what teachers and those that work in the schools should be asking for.
And this extends beyond the school. It's the school buses that pick the kids up, the cafeteria. So it has to be a very thought out program of distancing, limiting the amount in what has traditionally been congested areas as kids play around together. So it requires a lot of planning, but it can be done.
Mm-hmm. All right, well, thank you everyone for joining. If you need anything else from me, please feel free to follow up with me via email or phone call. I did put my email address in the chat box. Thank you all for your time. Thank you to our doctors for your time and for sharing this really helpful information to help keep students and our educators safe.